everyone. Today we're going to be covering military or war trauma. My name is Miriam Hepler. I'm going to be focusing more on the social emotional aspect and kind of like the relationship aspect of military traumas.
And hi everyone, my name is Katia Dos Santos, and I'm going to be focusing on the physical impacts that military trauma has on veterans.
All right, so just a brief overview. Like I said, I'm going to be focusing on the social and emotional aspect of military service and military trauma on vets and their relationships. So I'm going to talk mostly about the transition home or back into civilian life, and then the continued stressors that might be affecting them and their relationships when they come home. So I've actually identified a couple as my clients. So they're struggling with Jacob or the one partner's recent transition back into civilian life. That includes mental health and a few different other aspects. And the partner is struggling with, frustration and being unsure how to assist Jacob in his transition. So my clients are Jacob, who is the veteran, and Maggie, who is the partner. So if I was meeting with them, I'd start kind of like this. Thank you, Maggie. I'm really glad, that you guys were able to come back this week. I really think that we kind of have a good basis of where we're moving on from here. And so, my understanding of where we left things is that you're both struggling with Jacob's transition home or back into civilian life and his military service impact on your relationship. I just want to make sure that's correct with you guys. All right, so I'm going to start off by explaining some of the social and emotional troubles that veterans often face when they do transition home. I think that'll just help give you guys a clearer, little bit of an objective understanding of how that might be impacting Jacob's life and your relationship together. So when many veterans transition home or back into civilian life, they do experience culture shock, and that can be for a number of reasons. But if we think about the military and each branch on its own, we really need to understand that they are an entirely separate society of how we in typical US life would consider society. So they're going from a life where bond is one of the key points of their relationship. So even if you aren't emotionally bonded to a person, they're your brother. So you're kind of held to that standard of your brother or sister, and they're your family, and you take care of family. Everyone's kind of held to the same standards. Role hierarchy is clear, and respect comes along with your role as well. And then there's just a collectivism that's shared across the board. So they're kind of all in the same boat. Some have bigger boats depending on where you are in the hierarchy, and there might be less people on the big boats, but everyone's kind of in that same collectivism. And then when you come home, you enter back into a world where we really stressed individualism. And, there might not be the same community standards or morals that are shared across the across community or across kind of the board. And so when they do that, it's definitely a culture shock because it can be very stressful for them, where they're going from a place where everything's kind of set in stone. You understand what you're meant to do and what your needs are. And then you come home and you kind of have to rework who you are. And then for a lot of vets, when they transition, it can be hard to find a meaningful purpose in life. And that can impact their emotional and social well-being, as I'm sure you understand. So they go from making very large or impactful decisions or taking care of, tens to hundreds or thousands of other people. So sometimes what we think of as stressful here can seem very trivial. And that doesn't mean it's unimportant, but when you're dealing with something of such magnitude and you come home, that doesn't correlate exactly. Then for this aspect of the transition to go well, it's really important for the vet to engage fully in their social support. So whether that's Jacob, your relationship with Maggie, or you in the workforce or as a community member, all of those things are going to allow you to belong and accept and connect to your reintegration to civilian life. And then it's also extremely important to note that vets are subjected to a bunch of different traumas throughout their service. And so this places vets at a higher risk of PTSD, experiencing or inflicting physical abuse, substance abuse, depression, anxiety, suicide, or suicidal ideations. And it's also been found that vets with PTSD do have an increased difficulty with the transition back into civilian life, because that also causes difficulty in creating or relying on your social supports. So, meeting with you guys, I see that you guys are experiencing the social and emotional impacts of Jacob's military service. And as I'm sure it's taking a toll on each of you individually, it's also taking a toll on you as a unit. So one of the most important things throughout this transition is definitely going to be social support, as I kind of mentioned before. So when someone's supports or when a vet's supports are lacking, it's really important to grow in those supports, because otherwise their transition home and their progress is going to be limited. And kind of going into that, there is a study, regarding vets' needs for social supports, and that's titled "The Importance of Being There." And I thought that was a cool study for you guys, because the study found that the term "being there" kind of across the board was a core theme for their vets, and was a key quality that those veterans found in themselves as a social support, as well as in the individuals they identified as their supports. And personally, I have a friend who's a vet, and he tends to state being there a lot. And so that for them means whether you're in contact with that person regularly or they, hit you up every once in a while, you're there when they need you. That's how you can identify your people and how your people can identify you. And for him, that's across, with all the people he cares about, but it's much deeper. It has a deeper meaning with veterans or with his people who are active duty. And it's because it's a common thing that's held in that brotherhood or that family sense of the military. So that's just kind of a brief overview of kind of the social impact, but as we delve further in together, we'll be able to unpack Jacob's military history and, possible traumas that he's dealt with during that and how it's impacting your relationship now. But Maggie, I'm going to ask, that you try and remain a consistent support in Jacob's transition home, and try to help him engage with his other social supports so that way he can have an effective transition. And that's kind of how I would go about that. I'm going to...
All right.
All right, now your host.
Can you see my screen?
I can't see your screen.
Okay. I'll try again.
There we go.
Okay. All right. So now this is the part where we speak about the physical impacts on military war and trauma. And for this part, we're going to focus on a military veteran that's in his mid-50s experiencing health conditions. This specific client would like to know more information, about his health symptoms that he's been experiencing lately, and he just would like more support throughout, what he's been experiencing. So I wanted to start off by explaining to this client that one of the most common disorders that veterans have after service in the military is called post-traumatic stress disorder, which is also known as PTSD. This is the most common, and many veterans amongst themselves don't know about this disorder. So that's why I would like to start off with this disorder, because from this disorder stems a lot of other health conditions that he or she may be experiencing. So this is also known as shell shock or combat stress, and it occurs after you experience severe trauma or a life-threatening event. Some physical reactions are to remind the trauma of such pains as panic attacks. And there's also symptoms as uncontrollable shaking and heart palpitations. Osteoarthritis disease is also a disease that can stem from PTSD. It's a type of arthritis that occurs when flexible tissue at the ends of the bones wear down. The wearing down of the protective tissue at the end of the bones occurs gradually and worsens over time. This disease is a substantial disability among those serving in the military, and it includes young service members with acute traumatic injury. Many veterans also complain about respiratory conditions, and some may suffer from other respiratory problems through exposure of infectious agents or airborne environmental hazards. Examples of respiratory diseases that may be caused by infectious agents are tuberculosis, lung cancer, and pneumonia. Many veterans were exposed to airborne environmental hazards during military service, such as Agent Orange, burn pits, sandstorms, or fumes from aircraft exhaust. Most common diseases are hypertension and cardiovascular disease. Hypertension risk factors include sleep apnea and diabetes. For cardiovascular, post-traumatic stress disorder is associated with major forms of cardiovascular disease, including those such as coronary heart disease. People with PTSD have common anxiety disorder in veteran populations and have been reported to have increased risk of hypertension, hyperlipidemia, obesity, and cardiovascular disease. So after explaining these diseases to my client, I would then offer him or her more support in that area. He or she may be experiencing this, by themselves. They may not have no support in their family or friends. So referring them to the most appropriate services would be appropriate during that time. And that's it for me.
All right.
Did you stop? I feel like